It has come to my attention that majority of women in this country have never heard of HPV vaccination. Then, those who have heard of cervical cancer pap smear screening were all told that it is very painful and uncomfortable, so they have never done it. Now, with cervical cancer being the second commonest cancer in women, today I've decided to clarify on these two issues. Most cases of cervical cancer will be caused by the HPV virus. It is very common in our setting and usually it will be sexually transmitted. In fact, the very number one step to avoid cervical cancer is to have one sexual partner and to stop giving men who are not circumcised. They are the ones who carry the virus. Vaccination should be done between the ages of 9 and 14, where it is given as 2 injections that are 5 to 6 months apart. In case someone misses getting vaccination in that age range, but they are still between the ages of 15 to 45, or in people who are immunocompromised, for example, people with HIV or having a weak immune system, they should get 3 doses. So they get the first dose, then they get the second dose after 4 weeks, then they get the third dose after 6 months. These vaccines are all free at government health centers and they will protect you from cervical cancer up to 90%. On the other hand, a pap smear should be done for all women 25 years and above, where we look at your cervix for any changes that could progress into cancer, what we call the precancerous cell transformations. So a nurse will put you in lithotomy position, that position you'll be in when you're giving birth. Then, using a speculum, a camera, and a few dyes, she will look at your cervix and she will take a few pictures. And it will not be painful at all. It should be done for all women 25 years and above, and they should do it every 3 to 5 years. Major advantage of a pap smear is that it can not only detect the transformational changes, it can also treat them in real time. So during the procedure, in case the operator finds these transformational changes, they can either use a hot loop and they scrap them off, or they can use cryotherapy where we use very cold gas and we freeze them off, or any of the other ways, and this will prevent the progression to cancer.